Hip and knee replacement often gets branded together as if it's really one is the same as the other. And whilst there are some similarities, not least the actual outcomes, really they are two very, very different procedures. So with a hip replacement, I think the first thing to say is often the pain can be extremely disabling. And so patients' requirements for a hip replacement can often be quite extreme. Then the approach to the actual to the joint is also obviously very different. The hip is deep down inside the body, which on the one hand makes it sound like it should be very difficult, but in fact it can often mean that the operation is relatively straightforward to do, and sometimes for a lot of patients they have not that much pain afterwards. However, for a knee replacement, for instance, it's very easy to approach the knee. It lies just underneath the skin, flip the patella out of the way and you're straight there. But at the same time, because you have disrupted the soft tissues around the knee to get there, it can be quite sore in the post-operative period. So both hip and knee replacements nowadays are generally done with a length of stay which is maybe only a day, maybe even just the same day as the actual operation. But when patients go home, for patients with hip replacements, there are precautions very often, advice not to do too many things, such as rolling over in bed and care about dislocation. But generally people can get up and going and the pain feels much better quite quickly. For knee replacements, people do need to work with their physiotherapist to get the range of movement back so that you can overcome the discomfort following the operation. However, again, by 6 weeks, whether you've had a hip or a knee replacement, most patients are getting back to walking moderate distances, driving, and starting to return to normal activities in life. So whilst there are similarities, there are differences, and maybe we shouldn't be thinking about them in the same sentence, but at the same time, it isn't that uncommon that patients do need both. Hip and knee replacement has really come on a long way since it was first developed, maybe 60 years ago. In that time, the biggest changes that have occurred are, first of all, the approaches to the hip. No longer do we require people to lie in bed for 2 or 3 weeks recovering from the operation. Instead, we get people up and moving very, very quickly. And that's partly because of the way that we can approach the joint now using less destructive surgical techniques. The posterior approach is my favorite, and there are others out there. But at the same time, the other thing which has developed greatly is actually the materials that we use when doing a hip or knee replacement. And what we talk about is the bearing surface. So in the early days, they were using other things other than plastics, but nowadays we use ultra high molecular weight polyethylene, which has been treated. And these new treatments have only been around for about 10, 20 years, but are showing fantastic results, so that we can nowadays do a hip or knee replacement in somebody maybe even as young as 50 and not really have to worry too much about it having to be revised later on in their life. Nowadays we're seeing success rates where if you have a hip replacement done or a knee replacement done at the age of 50, there is less than a 50% chance it might need to be revised later on in life. There are new technologies and developments occurring all the time. Not all of them lead to greater or better outcomes, and we should, remember that everything has to be tried and tested before we know really how well it will work. But new developments include the use of robots and computers, and I think those are going to improve outcomes. But the trouble is, when you start with something that's so good in the first place, it's hard to see that wonderful improvement so quickly. Hip and knee replacements are always performed in hospitals, I would hope, and nowadays the choice of anaesthetic is generally either a general anaesthetic or a spinal, Most people prefer a spinal. The post-operative recovery is a little bit quicker, a little bit easier, but there isn't too much difference between each. Most patients will come into hospital and have their operation on the same day. The operation normally take about an hour, and then when patients are back on the ward, they'll be quickly got out of bed to go to toilet and start doing normal activities. This will be helped by physiotherapy. Over the coming few hours or days, people will have climbed the stairs and walked little distances, and when they've achieved that, they can generally go home. As I say, this normally happens within a day or maybe two of surgery. Over the coming few weeks, people will get back to walking and gentle exercises, and generally, certainly I see people at about 6 weeks after the operation, and that's partly because at that stage people are wanting to know whether they can return to driving and other simple activities. For hip replacements, we'll often see quite a rapid recovery, and people are getting back to relatively normal activities at 6 to 12 weeks. It can be the same for patients who are having knee replacements, but I do tend to warn people that it can be sore, and particularly if you're walking longer distances and trying to do other general activities, it can take quite a while for a knee to settle down, and certainly the literature will say it can take up to 2 years to know how well a joint has recovered. The typical recovery timeline for both a hip and a knee replacement is that after the operation, most patients are in hospital a day or maybe a little longer. In that time, they will be seen by the physiotherapists, they'll be got out of bed, and once they're safe on stairs, be allowed to go home. Over the coming few weeks, they'll get back to gentle activities, and I see most patients 6 weeks after operation when they're getting back to driving and walking the same sort of distance that they were before the operation. At this stage, most patients have not returned to full activities. We generally expect that if you want to go back to gentle sporting activities such as golf or tennis, that might take maybe about 3 months. And sometimes people can experience discomfort for anything up to a year or two, but I would expect that to be subsiding over time. By 2 years, most people are really not noticing their new joint at all. Hip and knee replacement have revolutionized patients' pain and well-being. Before hip replacements were available, people would be struggling to walk, having to use crutches or wheelchairs. Nowadays, if you have your hip replaced, you can expect to be getting back to essentially a full, normal lifestyle fairly soon after the operation. Just think about Andy Murray and how he's returned to tennis, or the number of people you'll know who've had knee replacements and can even run moderate distances. I'm not necessarily in favour of people returning to high impact activities. It will, after all, put extra stress on the joint and lead to maybe later complications. But in general, most people will return to playing with their children or grandchildren, getting back to walking and days out as they would do with their family, and just leading a normal, happy life free of pain. It is one of the wonders of surgery, the results of hip and knee replacements.